To my left is Dr. Martin. We're going to ask him to talk to us again about heel pain in general. You know, I deal with a lot of wrist pain, and I'm looking at a foot as just an ugly hand. And so one of the most common things I see in my practice as a hand surgeon is people complaining of generalized wrist pain. It's also a very common thing that the analogous part of the foot and ankle translates into heel pain. Hold our model again and tell us a little bit how you deal with foot pain and what are some of the diagnoses that translate into this very common presentation.
So with all the foot pain, generalized foot pain that we see, we can usually break it down, as we were mentioning, to the different areas where you have forefoot pain, which deal with the toe joints, which typically have different causes. Then you have your midfoot pain, which also leads from either injuries or arthritis or joint damage over the years. And then your rear foot pain, which heel pain has to be one of the most common complaints that we see on a daily basis.
And one of the toughest to get better.
It is. And unfortunately, it doesn't get better right away. It does take a lot of work with the patient on getting it better over time and differentiating between different types of heel pain. So there's heel pain on the back of the heel, which involves the Achilles tendon, which is the large tendon that comes down from your calf muscle and attaches to the heel. And then there's heel pain on the bottom, which this model shows a nice little heel spur, which a lot of people have as well. They are treated in some ways the same way, and then you have to change up different treatments depending on if it is heel pain on the back or heel pain on the bottom. Heel pain on the bottom is most common. There is a structure that attaches to the heel. It's basically, if you think of it like a ligament, which is a structure that goes around joints, but instead this one runs from the heel to the ball of the foot. It can become inflamed for different reasons. And figure out the reason for the inflammation and then how to get rid of the inflammation, because in the body, for most cases, especially when you're dealing with bone and joint issues, inflammation results in pain. With heel pain, first is figuring out the causes. A lot of people, it's from shoe wear or change in activity. I've seen patients who have had an injury, such as a construction worker that I dealt with that had a direct heel trauma where it's stepping down and having to fall, where blunt trauma to the bottom of the heel caused the inflammation. And unfortunately, there are some patients who just have heel pain for no clear reason. But the treatment typically starts off the same as the conservative treatment that we previously talked about. With heel pain, you want to avoid surgery if at all possible. It involves usually anti-inflammatory medicines that we start off from prescribing, as well as home physical therapy exercises.
So anti-inflammatory medicines are things like Advil and Aleve, ibuprofens, right?
And ibuprofens that help get the inflammation out. And then there's different home exercises that we do, and then if those fail, you go on to possibly physical therapy or the boot immobilization, where you end up in a boot immobilizer, which is a big Velcro boot that sort of lets everything calm down but still lets you to go about your daily activities such as walking.